Good day, lovely people. My name is Benita James, and welcome back to Ema-enthuse channel. Today, we're looking at another disease known as Alzheimer. Alzheimer is a type of disease under dementia. So, under Alzheimer, I'll be looking at the meaning, the causes, the symptoms, the transmission, preventive measures, stages, how to know if a person has Alzheimer, how to care for the patient, and treatment, and lastly, summary. So I'll be discussing this very important topic with my sisters, yeah? So firstly, I'll be talking about the meaning of Alzheimer. So Alzheimer is a stage-by-stage neurological disorder that affects the brain and also affects a person's physical life. So I'll also be asking my sisters here of the causes and other things I listed before. So Sister Ability, can you tell us the causes of Alzheimer?
Thank you so much, Sister Benita.
You're welcome.
Because of causes of Alzheimer's disease, number one is genetics.
Okay.
If you have anybody who has this disease in your family,
Okay.
it may inherit or you may have this disease through this because the mutation in the gene may be transferred to you. Another one is your age. Age also causes this Alzheimer's disease.
Okay.
Age is a greatest risk factor, with most cases occurring in people that are 60 years and above.
Okay.
Another one is family history.
Okay.
Having a family history of Alzheimer increases the risk of this disease because it can be from parents to offspring or from your uncle to another person. Another one is lifestyle factor.
Okay.
Poor diet. You don't take the right nutrients for yourself. You take the ones that your body cannot absorb. Another one is lack of exercise. You don't exercise your body. You don't sleep. You don't rest. That's also a cause of this disease. Another one is smoking, which should contribute to this disease. You know, when you're smoking, it affects your lungs and your brain. So this may also cause this disease. Thank you so much, Sister Benita.
You're welcome, Sister Ability. So, Sister Bokobo, can you tell us the symptoms of Alzheimer?
Symptoms of Alzheimer's disease. Number one, memory loss.
Okay.
Forgetting recent events, situations, or familiar words, or even your family and friends. Secondly, confusion.
Okay.
This implies when the person is having difficulty understanding places, times, or maybe, for example, the person can see you immediately and be like, "Who are you?" Meanwhile, you are familiar with the person. Maybe meanwhile, you're the person's sister, maybe that person's brother. Then, thirdly, communication difficulties. A person can struggle to find the right words, or maybe, for example, you can be conversing with the person and immediately the person will forget what he or she was talking to about with you. And also mood changes. The person become easily aggressive, easily agitated, easily anxious, maybe easily depressed. Maybe you can see the person now and then over some time, like few minutes or so, the person become anxious and any other mood. Then personality changes. The person can withdraw from social activities or maybe apathies, etc.
Thank you so much, Sister Bokobo.
You're welcome.
So, Sister Bright, can you tell us how this Alzheimer disease can be transmitted?
Thank you so much, Sister Benita.
You're welcome.
The transmission of Alzheimer's disease. Alzheimer is not contagious. Genetic inheritance. Genetic play a role through the transmission of Alzheimer's disease.
Thank you so much, Sister Bright.
You're welcome.
So, Sister Bokobo, can you tell us the preventive measures of Alzheimer disease?
While there is no guaranteed way to prevent Alzheimer's disease,
Okay.
research suggests that healthy lifestyle that implies that you take balanced and healthy diet and also regular exercises.
Okay.
Secondly, cognitive stimulation. Engaging in mentally stimulating cognitive exercises to help build the cognitive reserve.
Okay.
And also managing chronic conditions. For someone that has any type of disease like diabetes, hepatitis, or other form of disease, you can try and prevent it or maybe try and cure it so that it can prevent the risks of having this Alzheimer's disease. Thank you so much, Mr. Benita.
Thank you so much, Sister Bokobo.
You're welcome.
I'll be talking about the stages of Alzheimer. We have 3 stages of Alzheimer. In stage 1, the memory loss decreases, causing anxiety and depression. In stage 2, the memory loss decreases and the anxiety and depression decreases as well. Also, numerical concentration also decreases. In stage 3, confusion is profound, causing hallucination and delusion. Thank you so much. So, Sister Ability, can you tell us how we can know that we are infected with Alzheimer's disease?
Thank you so much, Sister Benita.
You're welcome.
Number one is medical history. When you review your medical history in the hospital or the clinic, you get to know whether you have Alzheimer's disease
Okay.
or not. Another one is cognitive functions, evaluating your memories, attentions, problem solving skills. Thank you so much, Sister Benita.
Thank you so much, Sister Ability. So, I'll also be looking at the behavioral changes. First one is the person will be agitated easily. The person will get angry easily. Anybody that is faced with Alzheimer's disease easily get angry. Secondly, the person will easily forget things. For example, you might talk to the person, have a conversation with the person, but let's say after some minutes, the person will forget what you said. So the next one is caring for the person. So, Sister Obukobon, can you tell us how we can care for the person that has Alzheimer's disease?
Caregivers can help to care for someone that has Alzheimer's disease.
Okay.
Firstly, provide emotional support. That means reassure the person that everything is going to be okay, and also offer the person empathy and understanding, and don't be harsh on the person.
Okay.
Secondly, create a safe environment. That is, make sure that the person stays in a hazard-free environment and keep the person from things that will harm the person, or maybe from rooms or objects or anything of any kind that can harm the person. Thirdly, encourage independence. Help the person to know that he or she can be independent in decision making or any activity that he or she wants to perform. Also, seek support. You can go to support groups or maybe hospitals or anything so that the person can get support that will help the person to go around with her daily activities.
Thank you so much, Sister Bokobo.
You're welcome.
So, Sister Brian, can you tell us the treatment of Alzheimer's disease?
Thank you, Sister Benita.
You're welcome.
The treatment of Alzheimer's disease: 1. Medication. 2. Therapy. That is occupational therapy. 3. Lifestyle modification like social engagement that can help to manage these symptoms.
Thank you so much, Sister Bright.
You're welcome.
If you notice that you have Alzheimer's disease, go to the hospital and meet a psychiatrist, a neuropsychiatrist, or a neurologist. Thank you so much. So, Sister Bokobon, can you help us summarize all you know about Alzheimer's disease?
Alzheimer's disease is a progressive neurological disorder that affects memory, thinking, or behavior. The exact cause is unknown, but genetics can also affect Alzheimer's disease.
Okay.
Though there is no cure for Alzheimer's disease, but if someone should use the following methods like exercising, balanced diet, therapies, lifestyle changes, or any other form of health related benefit, it can slow down the progression of this Alzheimer's disease. And also, if you notice that you've had Alzheimer's disease, please make sure that you go visit the doctor. And my sister here had already told us the doctors to go and visit. Thank you. And also try and get early diagnosis, because as we have said earlier, there is no cure for it. Once you've had it forever. So if you can get therapy to actually slow down everything, so just try and get early diagnosis, and also try and go to support group, and also get your family and friends to help you out. And if you're a caregiver, please handle these patients carefully. Do not be harsh on them, because they don't actually know what they're doing, because their brain is actually damaged. You don't expect them to behave normally like how we do. So when you get to have anything to do with them, you just be calm with them, and then don't treat them harshly, and respect them, and they also respect you too. Thank you so much.
Thank you so much, Sister Bokobo. Remember to like, share, comment.
Bye.